What's up, guys? How are you? Once again, I'm back. Oh, yes. So I hope everybody's had an amazing week and you ready for this podcast today. This is Talk Real and Raw with Sho'Nuff. And of course, I'm Sho'Nuff. Today we have an amazing chiropractor doctor. Okay. Dr. Casha Smith. Let me tell you, I have seen her work. I have had her work done on me. The lady is awesome. So let's welcome Casha Smith in. Wait a minute, let me get her in here. Add to stage. Well, hello, gorgeous.
Hi.
Look, and it's Casha Smith. Look, I'm still working on my music. I know that's right. I'm still look. I gotta get my little noise and my going, but I get there.
I know you were supposed to have some type of intro, like beat, like had Kendrick in the back, so I can
Look, I'm gonna get it. I'm gonna get it. I'm gonna get it. It's coming. Give it time. It's coming.
Okay.
But I used to do my little beat, or I'll say, yeah. But it's okay. It's working. What's going on, Dr. Casha Smith?
I know you. So I want to because they see me. They can see me.
Yeah, they can definitely see you.
So look, first I'm going to apologize, everybody. We had a major flood in our house about 3 weeks ago. So my office is being completely renovated in the home. And this is what you get. I guess that you got Sho'Nuff raw. This is raw. Mm-hmm.
You better say it real and raw, okay? Girl, please. As beautiful as you are, they don't see that building behind. They don't see your office.
Oh, thank you. And another, I'm gonna apologize too because I got all the dogs in here because they wanted to come in the office with me. So if you
and Apollo right here, right here.
Girl, Tinkerbell right here. She just passed gas. Passed gas.
She said she wanted to be on it too, real and raw. Let's go.
Tinkerbell. You know how pit bulls are, they act like they don't hear you.
Oh yeah, definitely. Or either they're gas and look back at you like you did. Girl, that's what Apollo do to me.
I love me some pitties. These some stinky little dogs, though.
Girl, I'm telling you. Look, all I just don't want him to bark. Long as he lay right here and do good. Girl, he done showed off one time. But if he sees somebody go across that door, he is on.
No, I know. That's why I prefer her to be in here with me. She'll lay right here. But other than that, outside of me, she on her own out in the wilderness. The house, we got the doorbell ringing. My niece, people at the pool.
Yeah.
It's I don't know.
I know that's right. So, Dr. Casha, tell us about who Dr. Casha Smith really is.
Oh my goodness. At 41, I'm trying to figure, did I say my age?
Girl, it's all right. For what? 41 where? Okay. 41 where? What? Slave.
Decade, you change a little, and I guess you settle into who you are becoming, and then it kind of always shocks you. You I guess I'm not dealing with this. I'm not putting up with this. I'm a Black female that is a chiropractor, and I specialize in sport injuries. But that is not to say I only treat sport injuries. I treat everything from car accidents to babies to everyday neck and pain, headaches, migraines, menstrual cramps, everything.
Oh, wow. Menstrual cramps. Okay.
Didn't I help you like ages ago one day?
Girl, let me tell you remember when I couldn't do my arm? I couldn't open my arm up and I had a fight coming. OMG, I was like, what? And when I came, you said, come out here, I got you. Come, and I got it. Girl, when I tell you, when I left there, I was so amazed.
I think that was your debut in from amateur into
The
into
pro.
to pro. I
Yeah.
remember that.
Yeah.
I remember to the point on the second treatment, I done packed up my little stuff and drove 3 hours and was and was
You did. You did.
and you know what? You won that fight too. So
I did.
I think I think it was because of me.
Yeah, that's what it was. Cause if
Yeah.
it wasn't cause you, girl, I couldn't have hit her with that right hand. Shoot, I couldn't even extend it.
I know. I know.
Yes. And then I came right back to you after that because when I hit the girl, I pushed the bone under the other one. And
Mm-hmm.
yes,
Mm-hmm. That's how hard you hit.
that's how hard I hit.
Yes.
And I said, oh Lord, I gotta go back and see her again.
Yes.
Yeah. And look, I got a professional hand wrap for y'all. Okay? I had a professional hand wrap. How about she telling him how to wrap my hand? I was like, okay. Okay.
I
In the
remember
dressing
that.
room.
I remember at first I was like, am I stepping over toes? But then I was
No,
like,
girl.
he doing it wrong. He doing it wrong. Because I learned the right hand ain't the left hand. And left hand
Right.
ain't the right hand. So you don't need to be sloppy. You right? Yeah.
Exactly. And but you know what? And that's when because I had broke the hand and you told him no, like do it correctly. Like because you told I remember because I teach people how to wrap now like that. To turn your hand inside
Mm-hmm.
and wrap it like that.
Mm-hmm.
I was like, okay.
Mm-hmm. I just learned that too. And I used it on you that time.
Shut your mouth. See, won't he do it? It's all right, girl. Shoot. It protected me. It
We've
gave
been
me some more
together for a
years.
long time.
Huh?
I said we've been together for a long time.
Oh yeah, we've been together a long time.
I know.
Yeah. So tell us about how did you even get into chiropractic?
Oh my gosh, this is
Is
such a
that what you wanted to do in the
no,
high school or whatever?
nope,
Oh,
nope. Didn't even know what it was. Couldn't even spell it.
such
I
a
was like, see what? See. um, I never forget. So I was supposed to go to dental school, and I really, really, really wanted to be a dentist.
you
And
wanted to be in people's mouth.
girl, I love teeth.
But what
I
about breath? Breath come with teeth.
breath do come with teeth. Breath
Yeah.
come with teeth. But I would like to think that the people that with the bad breath and they go see their dentist that they want to get it fixed so they care about their hygiene.
Okay.
Yeah.
All
Yeah.
right.
Hit me with
Okay.
anything and I'll try to make the silver lining the positive side of it.
I know that's right.
I'm
So
trying.
you wanted to be a dentist.
I did. And I wanted it was coming up towards the end of my senior year in college, and I didn't take the DAT, the dental administration test. I because I was going to spring it on my parents that I was going to sit out a year and find myself. It's like I told them all I know is school. I've been to school, and I'm tired of school, and I missed the entry exam. I didn't apply to anything. And my stepfather, he was like, you better take your ass to school. And I was like, I don't even know what to do. I don't know what school to go to. I didn't apply. So here it is 4 months before graduation, and I start freaking out that I'm about to graduate and I don't have no job or no school lined up because I thought I was just gonna just be free.
No.
So one of the girls that I went to school with, her name was Sharon Days. Um, Funny story, she's the one who got me into all of this, but she's not even a chiropractor now. She ended up not even liking it and finished going to
Shut
nurse.
your mouth.
I think she's a nurse, a physician nurse or nurse physician or something.
Very bad.
Yeah, so she was like, well, why don't you why don't you come with me and visit this chiropractic school I was going to visit? And I'm like, what do you mean? Like, I don't even know what that is. She was like, I want you to go and see my chiropractor that was local in South Carolina. Because
Okay.
everybody, I went to South Carolina State, HBCU. Um,
Okay, South Carolina State. Let's go.
South Carolina.
Anybody that's out there, y'all better get in them comments.
Hmm. So, so then after that, I was just like, okay, I'll try. And I remember I was having migraines at that time because I was in a bad car accident that totaled the car about 6 months, 6 or 8 months prior in
Oh,
that summertime.
wow.
So I went to go see the chiropractor and then I visit Sherman Chiropractic School. And then they start talking about how chiropractic can help with headaches and all of this stuff. And then I was like, well, I didn't know that. And then, but you can't prove it. So then I was thinking like this school is something. They making up shit. Like you can't prove it, but yeah, you can fix my headaches and my right hip pain and all of that. Cause I mean the car accident was pretty bad. It actually caught fire with me passed out in the car.
Oh, wow, girl.
I told you that.
You never told me that.
Yeah, I got a new car that summer. I worked 2 jobs at Foot Locker and the Department of Housing and Urban Development, saved all my paycheck, got an Impala.
Get it.
Fell asleep behind the wheel.
Get it, girl.
Hit the median, the rail, car slid, caught on fire. Someone on the side of the road yanked me out that car. I don't even know.
No.
Yanked me out the car, and then it just blew up. Right, it blew up
Oh,
probably.
wow.
So I
Thank
was
you,
always,
Lord, for saving.
I know, right? So
Wow.
I was always having headaches, like migraines, like weekly, and a little bit of right hip pain. And
Okay.
so I start seeing that chiropractor and I visited Sherman. And so I was like, well, looking at the curriculum, the first year was identical to dental school. So I was thinking, all right, I will enter in this year, take all the classes, and while I'll try to get into a dental school and maybe some of my anatomies can transfer.
Yeah.
So I enrolled in Sherman, not really knowing truly what chiropractic was.
Okay.
And that summer, I didn't even have a full summer. I only had 1 month off, and then I left for Spartanburg. And they team you up all new meet, the new enter the first quarter with upperclassmen that was in the clinic so they can practice their skills on you. That girl
Oh,
Marsha seemed like she ain't know what she was doing to me, but she cleared my migraines. She cleared my. I was always having like numbness and tingling out my hand.
yeah.
She cleared that. She cleared my right hip. And then after about the third quarter, I thought that that was my calling, that I was supposed to be there.
Okay.
So at that time, my school was considered straight chiropractic, meaning that they didn't do any modalities of PT. They only taught about the spine and how to correct the spine and any like diagnosis that can go along with it. And
Okay.
so once I was getting into it, I wanted to do a little bit more, as in the sports aspect of it.
Okay.
So either I had to leave the school or take classes outside of the school. So
Oh,
I figured Sherman was the best place to be in terms
okay.
of I can be the best chiropractor. Like I know how to treat everything. I'm good with my diagnosis, my orthopedic exams, my protocol, and then I
Oh,
just have to
wow.
go out and just get extra education on the PT modalities, and that's what I did. I went to Parker College. I've taken several seminars. I have even volunteered with the fire department trying to understand um, initial injury. So,
Okay.
um, needless to say, 15 years in this, I think it's been about 15 years now. I have so much stuff behind my name and so
Wow.
knowledgeable, and I'm tired.
I know that's right. Girl, I know that's right. Oh my goodness. I remember when I came to your office the first time, girl, and you said, okay, I'm about to crack your neck. And I was
I
like,
ain't say
okay,
crack. I ain't say crack. I said adjust.
adjust. You did. Okay. I'm saying you cracked it. Because you cracked it, okay?
I adjusted.
You adjusted it. Girl, let me tell you, it was so quick. But I felt amazing after. Like, and you did my whole body. It was crazy. Oh my goodness. So I have a question. My my best friend, she has her something with her knee. But should she go to the chiropractor or she just need to go straight on to the doctor? Because she went to the doctor and I think I can't remember I think they gave her a shot, but I don't know. But I was like, let me ask the chiropractor and see what she's saying.
That's a really good question. Everybody, they there's this perception that like chiropractor is only for neck, is only for back. Um, we actually treat every joint in the body. So even if that means the knee, the wrist, the shoulder, the hip, I mean, that's just joints. We also treat soft tissues too. Um, when you go to a doctor, you have to make sure you pick the right, correct one. If you go to your family practitioner, your PCP, remember they are general knowledge. They supposed to be general of everything enough to send you to the specialist.
Okay.
Other than you getting your examination, your follow up, they probably monitoring your blood pressure, but that's where they stop. It may be a bacterial or viral infection that they can test with a strip there. If they can test it there, they'll treat it there with just prescription drugs. But other than that, everything else is outside. If you're having neurological, you go to a neurologist. If you're having stuff like your shoulder, you probably go to an orthopedist. If you're having something with your back that's really bad, you go to an orthopedist. But then when you go to the specialist, the first thing that they're going to do is examine you. And they might then render a referral for an x-ray or MRI or whatever image that they need.
Okay.
But if they stop at the exam, the only thing that they would do is just give you meds. And the
Oh,
medication is not going to fix something.
no.
The medication is just, if you don't have cancer or you don't have an infection, then medication is just suppressing things. You can get an anti-inflammatory, but it's only going to calm down inflammation for a certain period of time. That inflammation is there because something isn't right.
Wrong.
And
Exactly.
so until you fix it, it's going to keep going into the same circle and inflame it. So if they just literally examine you, give you medication, then that's not the right treatment. I mean, maybe you need some painkillers right there, but you still need to figure out what it is.
What it is, why you're taking. Because then that's when addiction of painkillers come in because you keep the pain stays there and you just keep taking it.
Right. And then if they give you an MRI, an X-ray. So now you're in this situation that you've been examined, you have an X-ray, but the X-ray or the MRI doesn't show that you're surgical.
Okay.
And if you're not surgical, they can't do anything else for you. If you're between that, I'm really, really in pain or I have these symptoms and you're not surgery, then in between here, that's where you start going to the physical therapist or the chiropractor. That's where we come in.
Okay.
Because if you're not surgery, they can't do
They
anything
can't do
else.
anything else.
So, in terms of your girlfriend, your best friend that has the knee pain, if she got a cortisone injection, I mean, her knee doesn't need surgery. She doesn't need knee surgery, so they're just suppressing or giving her anti-inflammatory, but it's going to keep occurring. It's going to keep. So she needs to see what stage is she in. If she's in a stage that, hey, that this could be rehabbed and treated, she could go to PT. She could go to a sports chiropractor like myself.
Okay.
But I really wouldn't know until I examine her myself
Yeah.
and or look at whatever images that she has.
Okay.
I
Oh,
Can I
wow.
drink my Truly? I'm sorry.
Yeah, you girl, it is real and raw, okay? Look, Sandra Yancey said she loved her chiropractor. She wish she had went started earlier, but she was scared. And you know, a lot of people say that. And because
Yeah,
I was one, you know, but I knew I needed it. Craig kept saying, you need a chiropractor. And then when you came, that was God sent. You know what I mean?
hmm.
Because we said to put our bodies through so much.
Oh yeah,
But
oh yeah.
then, yeah, and then like you don't think about how can you tell them, oh, Chad Beasley said he needs you. She
I
gonna give you her information, Chad, and you be right on over, okay? So tell us how important is it to get to come to the chiropractor and how often?
Okay, so I people come to me, and then whatever their treatment protocols is, you fix it, and then they ask me, "Well, when should I come back? Is that it?" Or they say, "Okay, that's it for me." But I always tell them that, look, it's probably good to start entering in some type of maintenance. And they like, "Well, what is the maintenance?" And I'm like, "Well, you brush your teeth." I like to think people brush their teeth twice a day, right?
Uh-huh.
Yeah, I know I
Let's
get.
hope so. Look, some of them out there, let's pray they brushing them once. Glory to God, they are.
Girl, let me tell you. So, side note. So, the one time I got nice teeth. So, the one time I brushed my teeth, and then then at night, I be so sleepy, and my husband had to be like, "Did you brush your teeth?" I'd be like, "I'm going in there and brush my teeth now." I look like,
I know that.
but you brush your teeth twice a day, and you still go to the dentist so they can clean your teeth.
Yes.
So that's what this is. So even though you feel good or you don't feel the symptoms, you should still be checked and adjusted regularly.
Okay.
So if someone has their spine like well maintained, I say once a quarter. I mean, it only takes really 5 minutes to check
Yes.
somebody. So you just come in once a quarter. But if you come in off an injury, let's say you're done, I'll say, okay, I'll check you in 30 days. Then 30 days goes to 6 weeks. Then 6 weeks go to eight, eight go to
Okay.
10, 10 go to 12. And I try to have people follow up once a quarter.
Okay. Oh, that's what's
And
up.
you can start getting adjusted as early as infant. I mean, just yeah, you can adjust a baby. Yeah, there's pediatric chiropractors that only special in prenatal
Shut
and
your mouth.
kids. Yeah.
Wow. Well, that's something I learned. You know, I love doing this part. I learn something every session.
Mm-hmm.
So, and okay, wow. So if a person, y'all got some questions, y'all better ask now. Oh, my best friend said she didn't get a shot. Oh, sorry. I thought she said she got the shot.
She's like, I ain't getting no shot. Hold on.
I didn't get no shot.
Me
Yeah,
let
I
me
didn't
clear this up right now.
get no
I didn't get shot. I'm in the early stage. They want me to lose. Okay. So early, can I ask you early stage of what?
shot. Okay, yeah. Well, let's see what she said about that.
Yeah, I just want to see early stage of what, because if it's early and it's not a late stage that it needs a knee replacement, then basically you could start getting treatment. Is dry needling a part of chiropractic work? I do dry needle. I do just about everything. So I do a lot of soft tissue. I'm considered one of the elite providers for ART, which that's a whole nother world. I do ART, I do laser, I coat laser, I do dry needling, cupping. I just do about everything. And basically, I feel like it it goes hand in hand with the manipulation.
Okay.
So you can manipulate, manipulate, manipulate. But if all the muscles around in that joint is constantly tight and spastic, it's going to keep pulling the joint out of alignment. So therefore, it's just good to do soft tissue work and try to break through that barrier of spastic muscles before you manipulate any joint, the knee, the back, the wrist, the elbow, whatever.
Okay. Oh, educate them, girl. Okay, so tell me, what is dry needling? Because I don't know what that is.
Oh, yes, right. I ain't never stick you.
Yeah, girl, no, we ain't doing no sticky.
So, dry needling is with the Eastern medicine, and I know you heard of acupuncture, right?
Yeah, yeah, yeah. Okay,
So you got acupuncture, you got dry needling, and you got wet needling. So
okay,
acupuncturists, they go off of a protocol, and their protocol is based off of energy. So
okay,
that's why if you have headaches, they might stick needles in your wrist or in your knee. So they're transferring the energy pathways.
oh,
Dry needling, we use the same needles but longer. So let's
okay,
think of the body like a cake. So you have your layers of cake. You got your skin, your subcutaneous layer right up underneath the skin. You have your muscle, and then you have bone. Dry needling, well, acupuncturists, they only come about right here to transfer energy pathways.
okay,
Dry needling, we're going to go past the skin, go past the subcutaneous layer into the actual belly of the muscle. If you hit the bone, that's fine. You're not going to do any damage. The needles
okay,
are so thin, you're not going to tear anything.
okay,
So
okay,
that is dry needling. Wet needling is when you have some type of physician that prescribe medicine, dip it in a liquid lidocaine, and then stick it in you.
and then stick it. Oh,
Yeah. So
okay,
the difference is they say, well, how does it work? You know how you have a Charlie horse and it's so spastic that you
yes,
don't know to grab it and
yes.
apply pressure, and then it will literally calm down. That's what the needles does. The needles go all the way through the belly of the muscle to treat the spasm.
Oh, wow, okay. Ah, educate, educate. Okay.
A lot of people say, does it hurt? If you have a muscle that is really, really tight, you will feel it.
Oh,
You,
yeah, definitely.
yeah,
Oh, you will feel it.
yeah. And it can
And
be,
it'll take you down.
it could. I have needle people, and after I have needle people, and one of my patients brought her wife to me.
Okay.
And I treated the wife and needled the wife, and then she left. And the wife, the patient, the first wife, that she called me and said, "What did you do to my wife?" She got in the car and she cried the whole way home, and she started talking about stuff from her childhood.
Shut
So
down.
it can release so much toxins. Just not only the needles, just the chiropractic adjustment, and it can be cupped together. And so you can release tension, you can be emotional, it can be painful, you can just there the result of it is just insane. But I always tell people to tell me how they feel the day after,
Okay.
within 48 hours, because then they'll see a world of difference.
Wow. That's what's up. Yeah. Yes, it is true. It is
Yeah.
a teaching relief. That is amazing. Oh, wow. That's what's up. Free
So,
treated cases.
can I respond to this, Miss
Okay.
Kathleen? She said, agree. She treated plantar fasciitis with dry needling, and it worked amazing, quick recovery. Let me tell you, that was a stubborn, stubborn foot that you must have, because anything with the foot is so painful. I try to do everything in my power before I needle someone's foot. Needling
Oh,
someone's foot, it helps. I mean, it is a world of a difference, but that process is so painful. It's like excruciating pain, and I have only done that one time because I'm pretty successful with plantar fasciitis. It's not that hard to treat, especially I use an ART protocol. And not only that, you just don't treat the fascia, the plantar fascia at the bottom. You need to start looking into the calves, because people with really, really tight calf, Remember that calf muscle come from here to here, and it attaches and runs into that Achilles. And then that kind of swoops into the calcaneus, and it's almost like it continues to go as the plantar fascia. So you need to kind of like treat these, and then those adductors of the big toe. So a lot of people that have flat feet will end up having plantar fasciitis. Not to mention, you will also need to do joint mobility in that foot, in that ankle, because sometimes that is stuck and it doesn't move. So once you start playing around with all of that, then you can kind of just free it in anywhere from like 4 to 6 visits. But if you go longer than that, then I'll probably stick them with a needle. But other than that, it is pretty is really effective, pretty painful.
Okay. Yeah, she said it was. She had it in both feet. Poor baby.
Mm-hmm. Mm-hmm.
Oh wow, Kathleen. Well, I hope your feet good, girl. You up and running now. Glory to God. No, Tree said. Oh, and she said that. When you said the beginning stage, she said the beginning stage of her cartilage is gone.
Oh, I'm going back up there. Uh, Kathleen
She
says
said I had
it's also
a,
helps not having a discus sprain. Um,
meniscus.
okay, so most of my cartilage is gone. So, do you miss? Is this your best friend, Miss Smith? You know you a Smith
Uh-huh.
like that.
Yeah, girl, I think it's something about y'all Smiths, girl.
That you drawn
Oh, I
to.
love you, Kathleen. Girl, I'm so glad your feet good because we need our feet. How you got to get around, girl? Kathleen said my feet all good now.
No,
I love you.
is Kathleen a runner?
Lord,
Are you a runner, Kathleen?
I don't think so. I don't think Kathleen will run.
Okay.
Let's
Okay, but Miss,
Kathleen like
I still will have to see for Miss Smith. I would still have to kind of like peek at your X-rays, and wherever you are in the world, there's always an ART doctor somewhere, and so you can kind of just type in, go into ART techniques, and just find a provider. And it's just not chiropractors that's ART. There are PTs, medical doctors, doctor of osteopath, basically any physician that can take these soft tissue classes and basically take the muscle through its direct range of motion and clear the joint.
hey man, let's go then. Anybody got some questions? She can help you out now.
Mm-hmm.
Oh, and we're gonna do what you call it? I guess she's gonna adjust me. In a few weeks, y'all, about a month or so, y'all gonna see her in action. We want y'all to see. So y'all better get y'all questions together because when she come back on, it's a wrap. But then y'all know after that, y'all have to stop paying.
So, so
And I'm free. Y'all have to get out your pocketbook now. Okay. Oh, my best friend said I'm going to get my records and visit the Dr. Smith. Okay, bet.
okay, okay. You bring Tori with you. Just come with Tori.
Ain't it? Cause I'm coming. Oh,
Yeah,
I'm coming.
yeah. You know what? Now that I think about it, I don't think you ever came to the Silver Spring office.
Yes, I think that was where you fixed my arm. Yeah. We remember? Yes, it definitely was. Because I said, Silver Spring, that's far. But I came and we went in your office, we went in one of your rooms. And remember, we was only in there for a few minutes. And you did something here and you did something
I
here.
think that was Ashburn.
No, it definitely wasn't. I promise you it wasn't. I've been to Silver Spring's office. Oh, they want you to come to the event September 7th.
September 7th. Oh, I would love to. I would love, 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 love to any other day except for that. I'm gonna be in Colombia.
Oh,
Yeah, I got invited to a professional event in Colombia before.
oh, wait, professional how? Like
Oh,
professional,
so I
like
have
your profession, or are we
it was
talking?
more like a women's meet and greet because I have done. I also do um, like dissertations for car accidents and as an expert witness of soft tissue injury. So I
Shut
met
up.
this. No, girl, I forgot to tell you that.
Yeah, but you've been keeping a whole lot over there.
Well, you know what? When I usually see you, if you're not injured, we talking about everybody. Let me tell you, I met Tori. I met Tori when I was doing a health fair in a gym,
Yes.
and she inspired me so much on my fitness journey. I
Get out.
start, I start boxing.
Shut up. Now I'm about to say,
I start running.
and then
Even put me in the ring with her, and I had to last 3 rounds. I just kept throwing punches. I was just, I think, I think Craig said one round I threw about 140. My chest was on fire. I was like,
girl, yes, I so oh
so
my goodness.
every time I see Tori, we don't really catch up. She always get on me about how unfit I am these days. So we can't really truly catch up because every time I see her, the first 2 hours, 2 to 16 hours, is telling me how much of a badass I was. Like they had me in the gym flipping tires,
Girl, yes.
taking about 2 boxing classes a day on top
Yeah.
of running like 3 to 5 miles. And then
Let
yeah,
me tell you, you was a gladiator. Your body was amazing. You was rock climbing, everything, like everything. And then you get married. I'm like, what in the John Brown? You people don't. I heard people just let themselves go. You ain't let go. You didn't let go, but you ain't do the extra though. I was like, oh, wait a minute now.
like then have y'all met Tori daughter? Then the daughter started talking about me. Oh my god. I was on they came to my house, they made me get on a treadmill. The daughter was in the background, was like, she can go faster. I was all the way down to like 5 minutes. That's fine, you used to be this fast.
Girl,
Everybody
don't feel bad because when she used to train me, I used to let her train me some days. Girl, she did me the same way, but
Simone,
she wouldn't train with me.
yeah.
She wouldn't let me train her. She was like, "Oh no,
Simone is bad. Simone is
bad
bad. She bad,
girl."
fucking bad. But you know what? She got me down. She helped me get me down for the wedding. So
Exactly. Was wearing, getting that dress in there. I
mhm,
said, look at her.
yes.
But you still gladiator. You just not. No, you glad. You ain't got the ADA yet. You gonna get it. You'll get it. You'll get it soon.
Well, you know what? That weekend, September 7th, I'm gonna send you a picture. Be matter of fact, when y'all come to the office, y'all gonna see. I'm gonna be
Okay.
gladiator by the time
Okay.
Silver Spring.
All right,
Yes.
we're gonna see. We about to see. You know it ain't that far.
No, it's not. No, it's not.
Yeah, it's July, and July is going really fast.
I know, I know, I know,
Okay.
I know, but I didn't want to tell you this, but I'm actually doing about a mile to 2 miles every other day. Yes,
Oh my goodness.
yes.
Because you know what? When I say I'm up every morning and I'm running 3 o'clock, you did say Oh, I'm about to join you.
Yeah, I ain't do that though.
Oh, wait,
I ain't do that. I ain't gonna lie. I'd be like, no, I ain't do that.
what you do?
I, I'm not even running. I'm, I'm running, walking.
Oh,
The first day I told Garrett when I first started to run, I was like, Garrett, I ran 2 blocks, and he said 2 blocks. Yeah, he was so disgusted with me. I was like, Jesus, I gotta stop.
oh, girl, you know I'm about to tell Simone this.
Don't, please don't.
Girl, oh, well, you know she'll be like, yeah, we're going up there, mom.
Yes,
Oh,
yes.
my goodness.
Oh my gosh.
Oh, well, you got a message. She said, oh, Lord, my best friend falling apart. She said, I got to plant us and said,
Uh,
oh, Lord.
yeah. I'll see you soon.
Yes. Yeah, I got to bring my best friend. You got to get her feet together now. You got to get her right. Girl, we got trips to take, and Lord, I can't be carrying her and pushing her in a wheelchair.
You be pushing along.
Girl,
I don't see that happening.
no, it ain't. It
No,
ain't. It ain't. We're gonna be doing this thing. Oh no! Look, now every time she comes, she gonna be ready to come up there to you.
girl. You know what? We actually have patients that come from Leesburg. So yeah, they come as far as Leesburg,
Oh, good.
Richmond. Oh my gosh, Baltimore. They come from DC. They just come from wherever.
Yeah,
But it depends on the severity. If it's something that it really truly does need multiple visits, then I'm going to try to find a physician that probably treats just on the same level as myself that's closer to you.
yes. Oh, that's good. Says she gonna hook you up, help
Mhm.
you find somebody like so you ain't gotta travel up this far, you know. But she's not here. She's in South Virginia, like she on North Carolina line.
Okay.
She's in my home. She's down home.
Okay. Oh man, that's far.
Yeah, that's far.
Yeah.
But she coming to get that work from Dr. Smith. Shoot, it looked like Hagerstown Chad Beadley coming too, because he was like, yo, I need you. Shoot, I need to get this body right.
Oh, Maryland going to have a comedy cookout. Oh, damn it. Is that on September? That's September 7th, the comedy cookout?
Yeah, that's what he said, September 7th.
Man, I would love to go to something like that. I love stuff like that.
Okay, well, the next time, and then you go and take your cars next time. I'm sure, look, I'll find out and we'll know the next one, and then I'll let you know.
Yeah, yeah. Well,
And you about to leave all your information so everybody can come to your office, everybody can contact you some kind of way, or they can email you or whatever, so they can get their bodies together, girl. They need it. Not they we.
I just join the chat, connect with YouTube account, join.
Yeah. Just you can put or you can type the information in.
You know, I don't. Mm.
Girl, don't start me the line because I don't know. Mm-mm. Lord, the poor producer of this, Lord, I'm telling you, big ups to Icon. Thank you, Icon. I love you so much. You are such a patient man. Girl, let me tell you, he every day, he would talk me through. And then when it's time for the show, girl, I gotta call him an hour ahead of time because he talked me through everything because I don't know anything. Yes, and my King Jacob, King Jacob says hi, Casha.
Hi.
Hi, Jacob. Girl, King Jacob is the same. Like I'm telling you, when I say these are boss men, King Jacob done taught me a whole lot real quick. And one phone call, girl, he was like, mm-mm. He laid it out. I was like, what? Yes. I said, yeah, I'm with the right group. My PR, big ups Desiree. So look, Cache trying to, oh, salute, babe.
I'm
King Jacob. Okay, good job. Oh, you in there, girl? I see you.
So I think if Casha sports, did that go?
Yes, and put all your information.
Yeah, I can't send it. So,
You can't say. Well, I think once you get off, just
uh-huh.
go into it. Go into your Facebook again, or go into my Facebook and just do it.
Okay.
Yeah, I think you could put the information like that.
I'm gonna try this.
I
Just
believe so. I'm not the one. Definitely not the one. Like they put me here. All I can do is be kind of cute and talk. I don't know nothing about the behind the scenes stuff. She trying to get y'all right, y'all. She trying to get her information in there to you.
yeah, I'm gonna just go ahead and just tag it on your Facebook because I don't know. As I'm typing it in, the comment has failed to post. Uh,
Oh, okay, yeah. So you might have to wait and do it. I don't understand why. I don't know. I don't know that part. But yeah, after, just go into it because it stays there.
okay.
So people can come back and watch it after and just look and see if you can post it. Okay, so your question before we go. First, I want to say thank you so much.
Girl,
Thank you for look, I'm telling you, this has been so good. Educating people. I'm so thankful. Thank you, Lord. I'm so thankful because so many people, like the first lady was like Yancy was like, it's like people need it, like we all need it, but they scared. So
mhm.
what would you say to those people?
So, you know, when someone's scared, they're scared. The only thing is, I can say if you know someone that is under chiropractic care, go with them to their visit. So I have so many of my patients like, I want to bring such and such to you. I want my mom to come to you. I want my wife to come to you, but they're scared. All I can say is just, why don't you invite your mom to or your wife or your daughter to a visit, and then let's see how that goes. Usually, chiropractors are a little bit more the the environment isn't really like the standard medical. You don't have that tension when you come in. It's kind of an easy feeling because once you're on treatment, it depends on the severity of the treatment. You might be there frequently. So it's more like a homey atmosphere, or you get to talk one on one with your chiropractor more than any other physician. I mean, I can never talk to my dentist. I can never talk to my dentist. Even when my homegirl from high school, like Dr. shout out to Natalia Thomas. We went to high school together. She went to Michigan and she fixed I'll never forget that she plugged my tooth for me. I went all the way to Chicago and she done plugged my damn tooth. Then she has a practice in DC. Whenever I try to call her, I can't talk to her. When I try to talk to my primary care physician, it's hard to talk to my primary care physician. When I want to talk to my GYN, can't talk to him, can't talk to my ENT,
Oh
my
wow.
nose. I'm always talking to the secretary or the nurse.
Yeah, yeah, yeah.
But with chiropractors, like we're so like open and we're always kind of like just warm, a little bit more warm on the side than a medical doctor. So once someone comes in and then they get the feel of the atmosphere, it takes that edge off, that bite
Okay, yeah.
off of they're not okay. I'm not as scared. I see everything other
Mhm.
than just seeing just someone go. It's
Yeah, exactly.
it's a whole thing. You come in, you kind of got to talk to them. You got to figure out what's going on. How did they feel? You do a quick exam, and then that's it. So, Jacob, you know what? I am so bad. I'm worse than Tori. I am worse than Tori. I am really, truly kind of not on. Instagram. I think I was on Instagram. The last time I was on was back here in like 2018. I'm just really bad at social media. I'm not good at it. It gives me a little bit of anxiety. And so I'm trying to work through that just because I know certain things aren't real. But once you see somebody, you can get inspired and just be like, yeah, I want to do this. And then once you see something, you start judging yourself and you start, well, I didn't do this, or I'm not here, or I'm not there, and then you forget all the stuff that you accomplished. So I have struggled with like Instagram and stuff and
Oh, yeah.
in Twitter. So I just don't have it. I mean, and I've accomplished a lot, like a lot at an early age, but yet it was just never good enough. I think that's kind of Tori and I, when we're really
Yeah.
hard on ourselves,
Yeah.
very competitive within ourselves. And
Yeah.
so sometimes you kind of don't sit back and just say, oh, you did this. And I'm working through that. So I don't have an Instagram.
He
Okay.
said, let him help you. He got you.
Oh man, thank you. I am on Facebook, but I'm not on Facebook. It is just my name, Casha Smith, CASHASMITH, and yeah, that's about it. I'm one of Tori friends, and I think if you go DOCCASHA dot Cache, that was my original IG, and I don't think that I posted anything since then. And that was probably when Tori said I was like fit. I was gladiator. Now, what you call me, a glad?
You just glad you ain't got the Ada yet. But you'll get there. You could be Gladys or Gladder or but you ain't.
She's so mean.
No,
How could
it's
you know the
real and
most
raw.
positive, thankful, humble person, but she's just
But you know what I said? You ain't got the Ada yet. I didn't say, girl, you ain't gonna get the Ada no time soon.
thank you.
I said yet, because I know you're gonna get it.
Okay, thank you.
Yeah.
Now, mind you, she wants me to go out here and do all the stuff I used to do.
Yeah.
You didn't have like employees and practices and husbands and 8 dogs and a house that's getting renovated. And yeah, she wants you to go out here, run a marathon next weekend, go climb in the same day.
Yes. What's wrong with it? You used to do it, so you're fine.
I had time on my hands.
Okay, well, it's okay. Yeah, and I know your husband. He encouraged you. He pushed you and be like, "Yeah, baby, let's go. You got it. Run that marathon. Yep, and we're gonna do rock climb. We're gonna do yes." He,
Tori, so last year, I think I don't know if I told you this. Last year, for my 40th birthday, I was like, okay, I'm going to do a triathlon. So the triathlon was on Saturday. My birthday was on a Thursday. The triathlon was that Saturday. And then that same the next day I ran the Cherry Blossom 10 miler. So I did a triathlon on Saturday, my first one, and that was so hard. I mean, after you get out the water and then you start biking, and then I remember I was biking, and then the water, then the rain came, and then the wind came, and I was like, oh my god, I don't feel good. So I just kind of like went over and like threw up a little bit as I was biking, but I wasn't going to stop. That was the competitiveness. I wasn't going to stop, especially
exactly.
that one hill. Oh my goodness. Then you drop that bike and then you start running and your legs don't work. Then you beating on your legs. I threw up on that race, on that run 5 times.
Shut your mouth, girl.
I cried when I got my medal. I was like,
I can see it too. I can see it.
so I think I got that picture up in here. Then the very next day, I went from Smithfield, Virginia, and drove 2.5 hours, went home, got me some compression stocks from Dick's, And then I was up at 4:30 in the morning to go do that cherry blossom 10 miler. And that was some bullshit. That
Mhm.
race had 39 million people in there, and you
Oh,
all running like this. And by the last mile, you can see me crying. And I was crying like this. And then Garrett taking pictures of me crying. And then I'm like this. I'm like, oh my God, this sucks so bad. Needless to say, I got 2 medals that weekend. But look, so then 3 months later, and I signed up for the Baltimore 10 miler. I wake up Garrett like, Garrett, baby, let's get up. We gotta go. He said, look, I ain't seen you run since April. he said, look, let's make a deal. If I don't see you train, I'm not obligated to go. If I don't see you outside running, biking, or swimming, don't drag my ass out this bed. I cried during that run too. I got that
that is,
medal. And that's and that's why when I was like the other day, I said, baby, I ran 2 blocks, and you looked at me like, that's it. You could have kept that to yourself.
that is so
So he's not supportive like he used to.
he, because you gonna come to him and say 2 blocks. Oh my God. That is so funny. Look, oh, King Jacob got you,
I,
girl.
no, you know what? I'm gonna reach out to this Jacob Anderson too. I'm gonna find you
Yeah.
on Facebook.
He
Yes.
he wanted to put him and Icon are the one like the producers of this.
Okay.
So
Yeah.
yes, I give Jacob. Is it okay that I give her your phone number so she can contact you? But yes, girl. Oh, thank you, King Jacob. Y'all make sure you follow me. You see what he said? Get
Yes. Yes.
on it.
Yes. Go follow your lot. Yep. Yep. I'm
Yeah.
actually pulling up my phone now. Got it right here.
Yes. Let's go. Okay, Casha, when we get off, I'm gonna call you back and or I'll text it to you. I'll
Okay.
text you his number.
Okay.
That's what's up. Thank you for helping her, King Jacob.
Okay. Thank you. Thank you. Thank you.
All right, well, girl, if you ain't had me on here crying, you are so crazy. But I truly thank you, boo. I truly thank you for helping us, educating us, because we need it. You
Yeah.
know, y'all bodies crooked and raggedy. Y'all better get it together. Go find you a chiropractor and get you back right, because you only get one body.
Yes.
You
Yes.
better take care of it so it can take care of you.
You can buy everything else, but you cannot buy a spine. Once it's gone,
Exactly.
that's it. That is it. You
Yeah.
can buy eyelashes, hair,
Hip,
knees.
knees.
You can buy a baby, but you can't. Let me not say that.
Well, you can now, baby. You can.
You just cannot. You cannot buy a new spine. That's
Exactly.
done is done.
Yeah, right. And a lot of people, once their spine start hurting them, it's downhill after that.
You know
So,
what? You being as athletes, y'all take your body through so much. It
so
just
much.
literally amazes me. But not just and I was so obsessed with getting like to know every injury of the sports community. But then you realize the housewife that cleans all day and picks up the kid, or
Yeah,
the school bus driver, or the police officer that wears all of that gear. Everybody takes their body through
yeah.
so much, so much. You got to take better care of it.
Better care.
Mhm.
Well, I'm going to be out there soon. And the people soon will get to see us together in your office, the new renovated office. Oh,
And then I'm gonna be gladiator.
oh, and she's going to be a gladiator because she knows she's going to be full body shown then, y'all. Okay. She like, So we about to see this 2 block turn to 4 blocks.
Good night. Thank you so much for having me, everybody. I really appreciate this time. Jacob, I'm on it. I'm on it. I really appreciate you.
All right. Thank you, guys. I love you, girl.
You, bye, girl.
Bye. Lord. Okay, guys, as you saw, I hope if you missed it, you're gonna get on it soon. Look at it yourself and just learn, take from what she said, learn. Uh, I'll let her know. Well, she'll see it that you said thank you for her being here. Thank you for being here. Thank you all for always supporting. Every Sunday we here. I got different people every Sunday at 7 o'clock, so y'all can learn. I want to educate you on the most that I can. And let me tell you, if you missed anything, make sure you go back and watch each show. Okay, because it's something to learn in every show about your kids going to college for a free ride. Yep, Gilbert Baskerville, the saxophone musician, he educated us on that to let you know how you can do that. Like, just make sure you get on, okay? Because you really need to learn and know these things. And if somebody's giving it to you for free, you better go jump on it. This is talk real and raw, and I'm going to give it to you real and raw and help you the best I can. Y'all have a blessed one. Enjoy your week. Enjoy it on purpose, okay? Make sure you give all glory to God and have fun this week. Be safe. Love you. Bye.